As people age, their sleep patterns often change. One common issue that many seniors experience is waking up in the middle of the night, especially around 3 a.m. This can be confusing, frustrating, and even concerning. But why does this happen? And what does it say about a senior's overall health? In this script, we will explore the reasons behind early morning awakenings and what they may mean. Understanding sleep cycles. Sleep happens in cycles. Each cycle lasts around 90 minutes and includes different stages: light sleep, deep sleep, and REM, rapid eye movement sleep. Young people tend to move through these cycles more smoothly, while older adults may experience shorter sleep cycles and more frequent interruptions. As we age, our bodies produce less melatonin, the hormone that helps us fall asleep and stay asleep. This can make it harder to stay in deep sleep, which is the most restful part of the cycle. When seniors enter lighter stages of sleep, they are more likely to wake up from small noises, discomfort, or even no clear reason at all. Why 3 a.m.? Waking up at 3 a.m. isn't random. The body's internal clock, or circadian rhythm, controls sleep and wake times. For seniors, this clock may shift earlier. This means they feel sleepy earlier in the evening and wake up earlier in the morning. If a senior falls asleep at 9 p.m., waking up at 3 a.m. might actually mean they got a full 6 hours of sleep. Still, 3 a.m. is not always the ideal wake-up time. If someone wakes up then and can't fall back asleep, it can leave them tired during the day. Understanding what causes this early waking can help improve overall sleep quality. Common causes of waking at 3 a.m. age-related changes in sleep. As mentioned, aging affects melatonin levels and circadian rhythm. These natural changes can cause lighter, more fragmented sleep. Health conditions. Conditions like arthritis, acid reflux, or restless leg syndrome can cause discomfort that wakes a person up. Sleep apnea, which causes breathing to stop briefly during sleep, is also more common in older adults. Bladder issues, needing to urinate more often at night, known as nocturia, is common with age. This alone can cause frequent awakenings. Medications. Many seniors take medications that affect sleep. Diuretics, for example, increase urination. Some drugs may also disrupt REM sleep or make it harder to fall back asleep after waking. Mental health. Anxiety and depression can lead to early morning wake-ups. Worrying thoughts may feel more intense in the quiet hours of the night. Poor sleep environment. Light, noise, an uncomfortable mattress, or room temperature can affect sleep more, as sensitivity increases with age. What it reveals about health. Frequent 3 a.m. awakenings are not just annoying. They can offer clues about underlying health. If someone wakes up often and feels unwell, tired, or has other symptoms, it may be time to look deeper. Physical health. Conditions like high blood pressure, diabetes, or chronic pain can disturb sleep. Mental health. Depression often causes people to wake up early and feel hopeless or anxious. Cognitive issues. Sleep disruptions can be an early sign of cognitive decline or dementia. Poor sleep also affects memory and thinking. When to seek help. Occasional early waking is normal, but if it becomes a pattern that affects daily life, it's worth discussing with a doctor. A healthcare provider can check for medical issues, review medications, and suggest treatments. Sleep studies may be recommended to check for problems like sleep apnea. Simple ways to improve sleep. There are many lifestyle changes that can help. Reduce 3 a.m. awakenings. Set a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Limit naps. Napping too long or too late in the day can affect nighttime sleep. Create a calming bedtime routine. Reading, listening to soft music, or taking a warm bath can signal the body it's time to sleep. Keep the bedroom comfortable. Use blackout curtains, keep noise low, and set a comfortable temperature. Avoid stimulants and alcohol. Caffeine and alcohol can disrupt sleep cycles. Try to limit them, especially in the evening. Stay active during the day. Gentle exercise like walking or stretching can improve sleep. Watch what you eat and drink. Avoid heavy meals and drinking lots of fluids close to bedtime. Natural sleep aids. Some seniors find relief with natural remedies. Always check with a doctor before trying anything new. Melatonin supplements may help reset the sleep cycle. Herbal teas. Chamomile or valerian root can be calming. Magnesium. This mineral helps with relaxation and muscle function. Cognitive behavioral. Therapy for insomnia, CBTI. This is a highly effective treatment for people who have trouble sleeping. It teaches people to change thoughts and behaviors that interfere with sleep. Many seniors benefit from CBTI, and it's often more effective than medication. The role of technology today. There are many tools that can help track sleep and offer insights. Devices like smartwatches or sleep apps can monitor how much sleep you get and how restful it is. This information can help doctors or individuals make changes. Don't stress about waking up. Sometimes just worrying about waking up can make sleep worse. It's helpful to stay calm. If you wake up at 3 a.m. and can't sleep, try getting out of bed and doing something relaxing until you feel sleepy again. How sleep impacts daily life. When seniors don't get enough rest, it can affect their mood, memory, and even physical health. Daytime sleepiness can make falls more likely. Poor sleep may weaken the immune system. Fatigue can make daily tasks feel harder and reduce independence. Getting quality sleep is as important as eating well and exercising. It helps the body repair, supports a healthy brain, and boosts energy. Sleep and memory. Sleep helps store memories and clear waste from the brain. Without good sleep, it can be harder to remember things or stay focused. For seniors, protecting brain health is especially important. That's why solving sleep issues like waking at 3 a.m. is more than just a comfort. It's essential for long-term well-being. Sleep and heart health. Did you know that poor sleep can raise the risk of heart disease? During deep sleep, the heart slows down and the body repairs blood vessels. Interrupted sleep may raise blood pressure and increase the risk of heart problems. That's another reason why waking up at 3 a.m. regularly should be taken seriously. Support from family and caregivers. Family members and caregivers can help by creating a calm bedtime environment, keeping a regular routine, and encouraging healthy habits. If a senior is waking often or struggling to sleep, gentle support and patience go a long way. Tips for caregivers. Keep a sleep journal to track patterns. Avoid making sleep a battle. Stay calm and reassuring. Encourage daytime activities to build natural tiredness. Talk to a doctor if sleep problems last more than a few weeks. The bigger picture. Sleep is tied to so many parts of life. Waking up at 3 a.m. may seem like a small issue, but it often points to something bigger. Whether it's stress, pain, or a sleep disorder, paying attention and taking small steps can make a big difference. Sleep problems are common with aging, but they don't have to be accepted as normal. There are many ways to improve sleep, feel better, and enjoy life more. Whether through medical support, changes in routine, or natural remedies, there is hope for a better night's rest. Final thoughts. If you or a loved one often wakes at 3 a.m., know that you're not alone. Many seniors face this issue. With care, attention, and the right strategies, it's possible to get back to restful sleep and better health. Sleep isn't just about rest, it's about living well every day. In the next section, we'll explore specific case examples and more detailed solutions for chronic early waking.